Hey everyone, it's Shauna Young, occupational therapist with Mountain Therapy Services. Today I wanted to talk about a simple splint that might be helpful, might be a game changer for your improving your hand function. It is called a thumb abduction or opposition splint. The reason why you might consider this is one of two reasons that I think of primarily. One is that if you have inability to get the thumb away from the palm due to weakness, if you don't have the strength to abduct the thumb away from the palm and also to extend the thumb. That may be one reason to consider a splint like this. And also if you have mild to moderate spasticity, you might consider a splint like this just to get the thumb into more of a functional position in order to improve your success with grasp, release, dexterity, being able to bring the pads of your finger and thumb together for opposition movements, for picking things up. So if that sounds like you, if you're trying to grab for things and you can't wrap your thumb around, your fingers are maybe starting to come along into a little bit greater extension and more active motion, but the thumb's not quite there yet, you are likely having difficulty being able to grab things that you need to in your environment. You may be having a hard time holding your hairbrush, grabbing onto a pen and holding it successfully. You might find that when you're writing, you're having to just wrap your thumb around the pencil, and maybe that's not how you held it before. You may have a hard time being able to pick up and manipulate small items. So if that sounds like you and you don't quite have that active muscle contraction to move that thumb out and away, or spasticity is interfering, I want to show you this and why this might be helpful. It's called a thumb abduction or thumb opposition splint. This particular one I have is made by McKie Splints. There are multiple splints like this out there. I received this from McKie Splint because I asked for it as a demo and I wanted to try it. So this is my honest review of it, though no financial compensation or anything for having received it or telling you about it. But this is the kind that I have because I wanted to try it out for you all and show you how something like this can be helpful. So this is a neoprene splint. It's easy to go on. You go on to the website and order the size that you need for your hand. When you place it on here, you can see it's flexible, but it does position the thumb out and away unless you had more severe spasticity. This curve kind of matches the crease at the base of your thumb. And then the wrist strap goes around and attaches through the web space, which is this area here between the thumb and the index finger. So what it does is it provides a gentle spring action to bring the thumb away from the palm into more of a functional position for grasping. And so you can work on it for functional activities. What I like to think of it as a splint to try when you're up and active and doing functional tasks that are otherwise too hard for you. When you think about learned non-use, if you are not successful having motions of your hand, it sort of perpetuates that learned non-use. Success, pain, difficulty, stress of it might cause you to try to use your unaffected side to perform the tasks. And so you're not building those connections between the brain and the hand. Furthermore, the hand helps drive the shoulder motions and provide purpose for the upper extremity. So being able to have some way to be more successful helps create those opportunities for greater movement in your day, greater repetitions, which we know are helpful for neuroplasticity. So consider a splint like this. And there's a wear schedule for any kind of splint so that you're checking out to see how does your skin look, especially with sensory changes where you may not be able to feel your skin very well. So you should be looking for redness, changes in color, temperature, making sure things are not too tight, taking it off after 20 minutes, taking a look at it there. But I think about it as, again, just as using during functional tasks. One thing I have noticed with these neoprene splints is that your hand can sort of get a little bit sweaty, and so taking it off, cleaning the skin, keeping this clean and dry is also important to do as well. So definitely worth giving a shot to see if that can help you to hold your hairbrush, grab for things, put cups away in the cabinets. Now they also did send me this that I can show you, which is a Supinator Pronator strap, and that's for if you have difficulty being able to bring your arm into more of a neutral forearm position. So if your forearm tends to be into supination and you have maybe mild, moderate spasticity, you could try something like this. I would say mild spasticity is probably going to work a little bit better for it, but basically you detach the Velcro here, and if your forearm is in more of supinated position, oftentimes you attach the skinny end of the strap to the back of the hand across the thumb joint. You reattach your thumb splint, and then you go around the forearm, and you'll see it pulls it into more of a neutral position. You go around the upper arm, and you can attach it. And this does allow for, if you need to trim it, both on the thumb splints and the strap, if you need to trim it for you, you can do that, and it gives you the instructions on how to do that. But it puts me more in a neutral position. Now, I'd say if you don't get this quite right, it does, it might have the tendency to want to slip. And again, you'd want to check the circulation and how tight this is. Remove it and look at your skin and see how you're doing there. Alternately, you could flip this the other way, and you can do the same thing if your arm tends to be more pronated into this palm down position. You basically do the same thing here, except for that you strap it on the palm side to wrap around the hand. You reattach your thumb piece here into the web space. And then if your arm tends to be here more so, then what you do is you wrap it around the forearm here, around the upper arm again, and now with that pull, it pulls it into more of a better position here. Now this one is not the perfect fit for me. I ordered one a little bit too big, just so that I could use it with my patients to have a little bit more of a middle ground for trying with them. And so I would advise that you use their sizing guides if you do go with this brand. But again, there are multiple to try. I do like this, especially this thumb splint. I feel like is the most functional piece, just for getting that hand open, so that you can practice actively anticipating the opening of the hand to reach for things, and also to practice on getting the thumb in towards the palm and then allowing that spring assist to relax your thumb back into more of an abducted position. One thing to say too about doing these kind of activities is it's important to have your arm in a supported and more relaxed position as much as you can to give your arm its best chance of success for movement. So reducing stressors, not trying to do your exercises when you have a lot going on, busy environments, chaos. Again, just trying to find a more peaceful place, position, and environment. So maybe this is a great tool for you. I think if that sounds like you're having a hard time getting that thumb away from the palm, and you can actively bring the thumb away from the palm, physically using your unaffected hand without pain, without a lot of effort, then it's definitely a good splint to try for improving your function in your hand. So hopefully we found a good splint option for you for increasing your functional success. Thanks, have a great day.